The honourable member for Courtenay-Alberni.
You're in the motion. It calls it a carbon tax emergency. Okay, Mr. Speaker, we know that the PBO and the Bank of Canada, the governor of the Bank of Canada, says it's about 0.15% impact on inflation of the carbon tax. It's about 15 cents on a $100 bag of groceries. What's really the emergency is the corporate greed emergency that's happening, the runaway corporate greed, Mr. Speaker, but that's not being dealt with. You know, we keep hearing emergency. We saw the Liberals host a summit on auto theft, and that's not an emergency, it's a serious issue. But what's an emergency? 42,000 people, Mr. Speaker, that have died from a toxic overdose. And this government still has not convened a meeting with First Ministers to deal with, you know, the leading cause of death between the ages of 19 and 59 in my home province of British Columbia. It's spreading across the country, skyrocketing deaths in Alberta, Saskatchewan, Ontario, Mr. Speaker. Yet this government has not convened even a summit on this crisis, Mr. Speaker. When will this government convene First Ministers to deal with the health emergency, Mr. Speaker, where we've lost as many people as we did to COVID-19, where this government spent less than 1% in their response to the toxic drug overdose crisis, Mr. Speaker, than they did in COVID-19? When?
Honourable Parliamentary Secretary.
Thank you very much, Mr. Speaker, and I'm always proud to serve with the member from Courtenay-Alberni in this House, and we've had many meetings together on harm reduction, on the toxic drug overdose crisis in Canada, and on ways to support people who are suffering from addictions. This morning, Mr. Speaker, we announced that our government will be investing a further $500 million into youth mental health, which will include addiction supports. But this is another occasion where we're faced with a war on evidence. The Conservative Party wants to suggest that that safe supply and that providing people with the tools necessary to fight their addictions and live another day is causing the overdose crisis and is causing the toxic drug supply, which are, again, false. Mr. Speaker, I want to commend the member from Courtenay-Alberni for his leadership on this and many other issues. I'm always proud to work with him, and I'd be grateful for an opportunity to sit down and discuss how we can take further action on ending the opioid crisis in Canada.